Diabetes is often talked about in terms of blood sugar, insulin, and diet, but what many people don't realize is that diabetes can silently damage one of the most precious human senses, vision. Diabetic eye disease does not usually announce itself with pain or sudden blindness. Instead, it develops quietly, progressing over time until vision is permanently affected. By the time many people notice symptoms, damage has already begun. Below is a fully expanded 700-word section on Key Point 1, written in a clear, educational, and motivational speech style, suitable for a long-form health video or presentation. Key Point 1. Diabetes can silently damage vision. One of the most dangerous truths about diabetic eye disease is not how severe it is, but how quietly it begins. Unlike many health problems that cause pain or immediate discomfort, diabetes-related eye damage often develops without warning. There is no early pain, no redness, and no obvious signal that something is going wrong. This silence is exactly what makes diabetic eye disease so dangerous. Many people believe that if they can see clearly, their eyes must be healthy. Unfortunately, this assumption is often wrong. Diabetes can damage the eyes long before vision changes are noticeable. By the time symptoms appear, the disease may already be in an advanced stage. High blood sugar affects the body at a microscopic level. Over time, excess glucose in the bloodstream damages small blood vessels throughout the body, including those in the eyes. The retina, located at the back of the eye, is especially vulnerable. It relies on a delicate network of tiny blood vessels to receive oxygen and nutrients. When these vessels are damaged, the retina cannot function properly. At first, these changes are invisible. Vision may seem perfectly normal. You can read, drive, and recognize faces without difficulty, yet inside the eye, blood vessels may be weakening, swelling, or beginning to leak fluid. This is why diabetic eye disease is often called a silent thief of sight. Many people with diabetes go years without an eye examination because they feel fine. Some believe eye problems only occur in old age. Others assume that vision loss will be sudden and obvious. In reality, diabetic eye disease progresses slowly, quietly, and steadily. This delay in detection is one of the main reasons it remains a leading cause of vision loss worldwide. Another dangerous misconception is that only people with poorly controlled diabetes are at risk. While poor blood sugar control increases the risk, even individuals who manage their diabetes well can develop eye complications. The duration of diabetes also plays a major role. The longer a person has diabetes, the higher the likelihood of eye damage, even if symptoms are absent. What makes this condition particularly alarming is that early-stage diabetic eye disease is highly treatable, but late-stage damage is often permanent. Once retinal tissue is severely damaged or vision is lost, it cannot be restored. Treatments can slow or stop progression, but they cannot reverse blindness. This is why early detection is not just important, it is essential. Regular eye examinations are the only reliable way to detect diabetic eye disease early. Specialized tests allow eye care professionals to see damage that cannot be felt or noticed by the patient. These exams can identify leaking blood vessels, swelling, or early structural changes in the retina, long before vision is affected. Ignoring routine eye checkups is not a harmless delay, it is a risk. Every missed examination is a missed opportunity to protect vision. Many people who experience diabetes-related vision loss later in life say the same thing: "I wish I had known earlier." The silent nature of diabetic eye disease also affects emotional well-being. Sudden vision loss can be frightening and life-altering. It can affect independence, confidence, employment, and daily activities. Tasks that once seemed simple, reading, driving, recognizing loved ones, can become challenging or impossible. All of this often happens not because help was unavailable, but because the warning signs were silent. Understanding this reality changes everything. When people realize that vision loss can begin without symptoms, they become more proactive. They stop waiting for problems to appear and start focusing on prevention. The key message is simple but powerful. Feeling fine does not mean your eyes are safe. Clear vision today does not guarantee healthy eyes tomorrow. Diabetes works quietly, but awareness speaks loudly. Protecting eyesight starts with acknowledging the silent risk. It begins with regular eye checkups, consistent diabetes management, and the willingness to act before symptoms appear. Vision is not something to protect only when it starts to fade. It is something to safeguard long before it does. In the battle against diabetic eye disease, silence is the enemy. Knowledge, awareness, and early action are the strongest defenses. If you want, I can expand key point 2 next, keep the same tone and length, or adapt this into a YouTube narration script. Below is a fully expanded 700 word section on key point 2, written in a clear, educational, and motivational speech style, consistent with the previous section. Key point 2. High blood sugar harms the retina. To truly understand how diabetes affects vision, we must look closely at what high blood sugar does inside the eye, especially to the retina. The retina is a thin, light-sensitive layer at the back of the eye that plays a critical role in vision. It receives light, converts it into signals, and sends those signals to the brain so we can see clearly. When the retina is damaged, vision itself is compromised. High blood sugar does not damage the eyes overnight. Instead, it causes slow, progressive harm at a microscopic level. When glucose levels remain elevated for long periods, they weaken the small blood vessels that supply the retina. These tiny vessels are fragile and essential. Once they are damaged, the entire visual system begins to suffer. One of the first problems caused by high blood sugar is leaking blood vessels. Excess glucose damages the vessel walls, making them weak and porous. As a result, fluid and small amounts of blood begin to leak into the retinal tissue. This leakage causes swelling, distorts vision, and interferes with the retina's ability to process light accurately. At the same time, some blood vessels may close completely, cutting off oxygen and nutrients to parts of the retina. When retinal cells do not receive enough oxygen, they become stressed and begin to malfunction. Vision may start to blur, especially when focusing on fine details, even though the person may not yet realize why. The body tries to fix this problem, but the solution often makes things worse. In response to reduced oxygen, the eye begins to grow new blood vessels in an attempt to restore circulation. Unfortunately, these new vessels are abnormal. They are thin, fragile, and poorly formed. Instead of helping, they break and bleed easily, spilling blood into the eye and blocking vision. This process is one of the most serious consequences of long-term high blood sugar. Bleeding inside the eye can cause dark spots, shadows, or sudden vision changes. Over time, repeated bleeding can lead to scar tissue formation, which may pull the retina out of place and cause severe vision loss. High blood sugar also disrupts the balance of fluids inside the eye. The retina relies on precise fluid control to remain healthy. When glucose levels fluctuate, fluid balance is disturbed, leading to swelling in critical areas such as the macula, the part of the retina responsible for sharp, central vision. This swelling can make reading, recognizing faces, and seeing fine details increasingly difficult. Another overlooked effect of high blood sugar is nerve damage within the eye. Just as diabetes damages nerves in the hands and feet, it can also damage the optic nerve, which carries visual information from the eye to the brain. When these signals are disrupted, vision becomes less clear, less stable, and less reliable. What makes this damage especially concerning is that it often occurs even when symptoms are mild or absent. A person may adjust to slightly blurry vision or assume it is due to aging, eye strain, or fatigue. Meanwhile, high blood sugar continues to silently damage retinal tissue day after day. The longer blood sugar remains uncontrolled, the greater the damage becomes. Years of elevated glucose increase the risk of permanent retinal injury. This is why people who have had diabetes for a long time face a higher risk of vision problems, regardless of how well they feel. It is also important to understand that sudden spikes in blood sugar can be just as harmful as consistently high levels. Fluctuating glucose stresses blood vessels, making them more likely to leak or rupture. Stability matters just as much as control. The key lesson here is simple but powerful. The retina remembers every period of poor blood sugar control. Damage builds over time. The eye does not forget prolonged stress, even if vision seems normal today. Protecting the retina means respecting how sensitive it is. It means recognizing that blood sugar control is not only about preventing fatigue or thirst, it is about protecting sight. Every effort to manage glucose levels helps preserve the delicate blood vessels that make vision possible. High blood sugar may be invisible, but its effects on the retina are real, lasting, and serious. Understanding this connection empowers people to take diabetes management seriously, not just for their health, but for their future vision. If you'd like, I can expand key point 3 next, keep it at the same 700-word depth, or adapt this section into a YouTube voice-over script. Below is a fully expanded 700-word section on key point 3, written in the same educational, motivational, and speech style tone as the previous points. Key point 3, early warning signs should never be ignored. One of the greatest mistakes people make when it comes to diabetic eye disease is ignoring early warning signs or dismissing them as temporary or harmless. Because vision changes can appear gradually, many people adapt to them without realizing that their eyes are sending urgent signals for help. These early symptoms are not minor inconveniences, they are critical warnings that damage is already underway. Diabetic eye disease does not usually cause pain. There is no burning, no sharp discomfort, and no immediate alarm. Instead, the eyes communicate through subtle changes in vision. Learning to recognize and respect these changes can mean the difference between preserved sight and permanent vision loss. One of the most common early signs is blurred or fluctuating vision. A person may notice that their eyesight changes throughout the day, clear one moment and blurry the next. This happens because unstable blood sugar levels affect the fluid balance inside the eye, altering how light is focused on the retina. Many people assume this is due to tiredness, screen use, or aging, but in people with diabetes, it can be an early sign of retinal damage. Another important warning sign is the appearance of dark spots, floaters, or shadows drifting across the field of vision. These may look like tiny dots, strings, or cobweb-like shapes. Floaters occur when small amounts of blood or fluid leak into the eye due to damaged blood vessels. While occasional floaters can be harmless, frequent or increasing floaters in a person with diabetes should never be ignored. Difficulty seeing at night is another subtle but significant symptom. Tasks such as driving after sunset or navigating dimly lit areas may become challenging. This happens because diabetes can damage retinal cells responsible for low light vision. Night vision problems often appear before daytime vision is affected, making them an early indicator of trouble. Some people notice that colors appear faded or washed out. Bright colors may seem dull, and contrasts may be harder to distinguish. This occurs when the retina and optic nerve are affected, interfering with how color and detail are processed. Because this change happens gradually, it is often overlooked until vision quality has significantly declined. One of the most alarming warning signs is sudden vision changes. This may include sudden blurriness, partial vision loss, or dark areas blocking vision. These symptoms can occur when fragile blood vessels rupture and bleed inside the eye. Sudden vision changes are a medical emergency and require immediate attention. Delaying care in these moments can lead to irreversible damage. Another overlooked symptom is difficulty reading or focusing on fine details. Letters may appear distorted, straight lines may look wavy, or small text may become harder to read. This can indicate swelling in the macula, the central part of the retina responsible for sharp vision. Because reading difficulty is often blamed on eye strain or aging, many people fail to recognize it as a warning sign. What makes these symptoms especially dangerous is that people often adjust to them instead of acting. They sit closer to screens, increase text size, avoid night driving, or ignore floaters. These coping strategies may make daily life easier, but they allow the disease to progress unchecked. Another reason warning signs are ignored is fear. Some people avoid eye exams because they are afraid of bad news. Others believe that vision loss is inevitable with diabetes and feel powerless to prevent it. In reality, early detection can slow or even stop the progression of diabetic eye disease. Ignoring symptoms does not protect vision, it endangers it. It is also important to understand that symptoms may appear in one eye before the other, making them easier to dismiss. The brain compensates for vision loss in one eye by relying on the other, masking the problem until damage becomes severe. Every visual change, no matter how small, matters when diabetes is involved. These signs are not random. They are messages from the eyes indicating stress, damage, or disease. The earlier these messages are recognized, the more options there are for protection and treatment. The most powerful habit a person with diabetes can develop is paying attention to their vision. Where you failed class slowly became talks, keying seriously and seeking professional evaluation early can preserve eyesight for years to come. The key message is clear: do not wait for pain, do not wait for blindness, do not wait until daily life becomes difficult. Early warning signs are a gift, an opportunity to act before vision is lost. When it comes to diabetic eye disease, listening to the eyes is not optional. It is essential. If you're ready, I can expand key point 4 next in the same 700-word format or convert all expanded points into a complete long-form speech. Below is a fully expanded 700-word section on key point 4, written in the same clear, educational, and motivational speech style as the previous key points. Key point 4. Diabetic retinopathy is the leading threat among all the eye conditions linked to diabetes. Diabetic retinopathy stands as the most common and the most dangerous. It is the leading cause of vision loss in people living with diabetes, not because it is sudden, but because it is progressive, silent, and often underestimated. Understanding diabetic retinopathy is essential for anyone who wants to protect their eyesight while managing diabetes. Diabetic retinopathy occurs when long-term high blood sugar damages the tiny blood vessels that nourish the retina. These blood vessels are delicate and vital. When they are exposed to high glucose levels over time, their walls weaken, their structure changes, and their ability to function properly begins to fail. This damage unfolds gradually, often without noticeable symptoms in the early stages. In its early stage, diabetic retinopathy may involve small leaks from weakened blood vessels. Tiny amounts of fluid or blood seep into the retina, but vision may still appear normal. This is the stage where the disease is easiest to manage, yet it is also the stage where most people are unaware that anything is wrong. Because there is no pain and little visual disturbance, many people unknowingly allow the disease to progress. As the condition advances, more blood vessels become blocked, reducing the oxygen supply to the retina. The eye responds by attempting to grow new blood vessels to compensate. However, these new vessels are abnormal. They are fragile, unstable, and prone to rupture. Instead of improving circulation, they increase the risk of bleeding inside the eye. This advanced stage is especially dangerous. Bleeding from fragile blood vessels can suddenly cloud vision, creating dark patches, shadows, or a dramatic loss of sight. Scar tissue may also form as the eye tries to heal, and this scar tissue can pull on the retina, leading to retinal detachment, a serious condition that threatens permanent blindness. What makes diabetic retinopathy particularly alarming is that vision loss can occur suddenly after years of silent damage. A person may live with diabetes for a long time without any eye symptoms, only to experience rapid vision decline once the disease reaches an advanced stage. This sudden change can be shocking and life-altering. Another critical aspect of diabetic retinopathy is that it often affects both eyes, though not always at the same rate. One eye may seem fine while the other is deteriorating. The brain adapts by relying more on the stronger eye, masking the problem until both eyes are significantly affected. Many people mistakenly believe that vision problems are an unavoidable part of aging, or that nothing can be done once retinopathy begins. This belief is not only false, it is dangerous. While damage already done cannot be reversed, early detection and proper medical care can slow, stop, or greatly reduce further damage. Regular eye examinations allow eye specialists to detect diabetic retinopathy long before symptoms appear. They can see subtle changes in blood vessels, tiny leaks, and early swelling that are invisible to the patient. This early awareness opens the door to timely intervention, which can preserve vision and prevent severe complications. The risk of diabetic retinopathy increases with the length of time a person has diabetes, but it is also strongly influenced by blood sugar control, blood pressure, and cholesterol levels. Smoking further increases the risk by reducing oxygen delivery to the retina. This means that lifestyle choices and medical management play a powerful role in determining how the disease progresses. Diabetic retinopathy does not discriminate. It can affect young adults, older individuals, and even people who believe their diabetes is under control. This unpredictability is why no one with diabetes should assume they are immune. The emotional impact of diabetic retinopathy is often overlooked. Vision loss affects independence, confidence, and daily functioning. It can interfere with work, driving, reading, and social interactions. For many people, the loss of vision is more frightening than any other diabetes-related complication. The most important message to remember is this: diabetic retinopathy is a serious threat, but it is not a hopeless one. Awareness transforms risk into responsibility. Early detection turns fear into action, and consistent care can protect sight for years, even decades. Ignoring diabetic retinopathy gives it power. Understanding it takes that power away. When people learn what this disease is, how it progresses, and how silently it can advance, they are more likely to take the steps needed to protect their vision. In the fight against diabetes-related blindness, recognizing diabetic retinopathy as the leading threat is not about fear, it is about readiness. And readiness saves sight. When you're ready, I can expand key point 5 next, keeping the same 700 word depth and tone, or compile all expanded points into one complete long-form speech. Below is a fully expanded 700 word section on key point 5, written in the same clear, educational, and motivational speech style as the previous sections. Key point 5, diabetes increases the risk of cataracts and glaucoma. When people think about diabetic eye disease, diabetic retinopathy usually gets the most attention, and for good reason. However, diabetes also significantly increases the risk of cataracts and glaucoma, two serious eye conditions that can quietly damage vision over time. These conditions may seem unrelated to blood sugar at first, but diabetes plays a powerful role in how and when they develop. Cataracts occur when the clear lens of the eye becomes cloudy. This lens is responsible for focusing light so that images appear sharp and clear. In people with diabetes, cataracts often develop earlier in life and progress more quickly than in those without diabetes. What might take decades to form in a non-diabetic person can appear much sooner when blood sugar levels remain high. High blood sugar affects the lens by altering its chemical structure. Excess glucose enters the lens and is converted into substances that draw in water. This causes the lens to swell and lose its transparency. Over time, the lens becomes cloudy and vision becomes increasingly blurred. This process is gradual, which makes cataracts easy to ignore in their early stages. Early symptoms of cataracts include blurry or hazy vision, increased sensitivity to light, glare from headlights or sunlight, faded colors, and difficulty seeing clearly at night. Because these changes happen slowly, many people adjust without realizing that a serious condition is developing. They may assume their eyesight is simply getting weaker with age, when in fact diabetes is accelerating the damage. Glaucoma presents an even greater hidden danger. It is a group of eye conditions that damage the optic nerve, which carries visual information from the eye to the brain. Diabetes nearly doubles the risk of developing glaucoma, making it a major concern for anyone living with the condition. In many cases, glaucoma develops due to increased pressure inside the eye. Diabetes can interfere with the normal drainage of fluid from the eye, allowing pressure to build up. Over time, this pressure damages the optic nerve. What makes glaucoma especially dangerous is that it often has no early symptoms. Vision loss begins at the edges, affecting peripheral vision first, while central vision remains intact. As a result, many people do not notice a problem until significant damage has already occurred. As glaucoma progresses, side vision gradually disappears, creating a tunnel-like view. By the time central vision is affected, the damage is usually permanent. Unlike cataracts, which can often be treated effectively if detected, vision loss from glaucoma cannot be reversed. Diabetes also worsens the impact of these conditions by weakening blood flow to the optic nerve and increasing inflammation in eye tissues. This makes the eyes more vulnerable to pressure damage and slows their ability to recover from stress. What makes cataracts and glaucoma especially concerning for people with diabetes is that they can develop alongside diabetic retinopathy, compounding vision problems. A person may be dealing with more than one eye condition at the same time, each affecting vision in a different way. This combination can significantly increase the risk of serious vision impairment, if not detected early. Another challenge is that symptoms of these conditions often overlap with normal vision changes. Blurry vision, glare sensitivity, and difficulty seeing at night are common complaints that many people dismiss. Without regular eye examinations, it is almost impossible to know what is causing these changes. The good news is that early detection can make a life-changing difference. Eye exams can identify cataracts and glaucoma long before they severely impact vision. These exams allow eye care professionals to measure eye pressure, examine the optic nerve, and assess lens clarity, things that cannot be evaluated without proper screening. People with diabetes should understand that protecting vision is not only about watching for retinal damage. It also means being aware of conditions like cataracts and glaucoma that quietly steal sight over time. These conditions do not cause pain and they do not improve on their own. Vision loss from diabetes is not always sudden. Often, it happens slowly, through conditions that advance silently while daily life continues as normal. This is why awareness matters so deeply. The key message of this point is simple but powerful. Diabetes does not only affect blood sugar, it affects the entire eye system. Cataracts cloud vision, glaucoma damages the optic nerve. Both can permanently reduce eyesight if ignored. Taking eye health seriously means recognizing all the risks, not just the most well-known ones. With awareness, regular checkups, and early action, many people with diabetes are able to preserve their vision and maintain independence throughout their lives. Understanding these risks is not meant to create fear. It is meant to inspire responsibility, because sight is precious, and once it is lost, it cannot be replaced. When you're ready, I can expand key point 6 next, or compile all expanded points into a complete long-form speech or video script. Below is a fully expanded 700 word section on key point 6, written in the same educational, motivational, and speech style tone as all previous points. Key point 6. Early detection can prevent vision loss. Among all the facts about diabetic eye disease, this is the most important one to remember. Vision loss is often preventable, but once it happens, it is rarely reversible. Early detection is the single most powerful tool people with diabetes have to protect their eyesight. Not medication alone, not technology alone, but awareness combined with timely action. Diabetic eye disease does not usually appear suddenly. It develops over years, slowly damaging the delicate structures of the eye. This slow progression creates a window of opportunity, a period where damage can be identified and managed before it becomes permanent. Early detection means catching problems before vision is affected, not after. One of the biggest reasons people lose vision from diabetes is not lack of treatment, but late diagnosis. Many individuals seek medical help only when vision becomes noticeably blurry or impaired. At that point, damage may already be advanced. Early detection shifts the focus from reacting to vision loss to preventing it altogether. Regular eye examinations play a crucial role in this process. These exams allow eye specialists to see inside the eye and detect changes that cannot be felt or noticed by the person. Tiny blood vessel leaks, early swelling, increased eye pressure, and subtle nerve damage can all be identified long before symptoms appear. This early insight gives doctors the chance to slow or stop disease progression. Another important aspect of early detection is that it allows for personalized care. Not everyone with diabetes develops eye disease in the same way. Some may experience retinal changes, while others may develop cataracts or glaucoma. Early exams help identify individual risks, allowing care to be tailored to each person's specific needs. Early detection also empowers people emotionally. Knowing the condition of one's eyes reduces fear of the unknown. Instead of worrying about sudden blindness, individuals can take informed steps to protect their vision. Knowledge replaces anxiety and action replaces helplessness. Blood sugar management becomes more meaningful when people understand its direct impact on vision. Early eye findings often motivate individuals to take better care of their overall health. When people see how closely their eyes are connected to daily habits, diabetes management becomes more than just numbers. It becomes about preserving quality of life. High blood pressure and cholesterol also play a significant role in diabetic eye disease. Early detection helps identify when these factors are contributing to eye damage. Addressing them early can reduce stress on blood vessels and protect the retina from further harm. One of the most powerful benefits of early detection is that it preserves independence. Vision loss affects far more than eyesight. It affects mobility, employment, social interaction, and confidence. Preventing vision loss helps people continue driving, reading, working, and enjoying daily life without limitation. It is important to understand that early detection does not mean something is wrong. It means something is being monitored. Many early changes never progress to severe disease when managed properly. Detecting a problem early is not a failure, it is a success. Another critical point is consistency. Eye health is not protected by a single exam, but by regular monitoring over time. Diabetes is a lifelong condition and eye care must be ongoing. Even if one exam shows healthy eyes, future exams remain essential because risk increases with time. Unfortunately, many people delay eye exams due to fear, cost concerns, or the belief that they are unnecessary without symptoms. This delay can be costly. Vision is far more difficult to restore than it is to protect. Prevention is always easier than repair. Early detection also benefits families and caregivers. Vision loss affects not only the individual, but also those around them. Protecting eyesight reduces emotional and practical burdens on loved ones and helps maintain independence for longer. The message of early detection is not about alarm, it is about empowerment. It is about recognizing that diabetes does not automatically mean blindness. With awareness, regular checkups, and timely care, many people with diabetes maintain good vision throughout their lives. The eyes are remarkably resilient when given the chance. They can adapt, stabilize, and function well when problems are identified early. But they need time, and early detection provides that time. The most powerful statement anyone with diabetes can make is this: I choose to protect my vision before it is threatened. Because eyesight is not something to take for granted. It is something to guard, monitor, and respect. Early detection is not just a medical step. It is a commitment to seeing the world clearly for years to come. If you want, I can now compile all 6 expanded key points into one complete long-form speech, or create a YouTube-ready script, SEO description, timestamps, hashtags, and tags, just like your previous projects.